Bill, share a little bit about your experience, either in consulting or when you sat in the seat. But what I've run across, and I'm thinking about some places. One was like a regular trauma center, and it was attached to a teaching facility with like a pedway, a walkway, and it was to a children's teaching facility. Um, I can think of that scenario in Wisconsin. I can think of that scenario in Minnesota. But these are attached and people work back and forth. Like, what does that look like for those security teams that are individual? What do those processes look like when it comes to physical access management?
Yeah, it's a part and parcel of the trend in healthcare. 10, 15 years ago, we saw larger hospital systems acquiring single hospitals, and now we're seeing systems
Mhm.
acquiring other systems.
Yes.
So, and when you're a system and you've already got maybe over $1 million invested in your access control system, and it's a good system, um, but then you're acquired by somebody else, and then you're starting to share staff and administration. Physicians have privileges and don't want the burden of having two badges to go from building to building.
Hmm.
These are the issues that we as physical security professionals are now confronted with. So um, I've had a couple scenarios here. Well, one is you have two hospitals that just, they're right next to each other. They're across the street or whatever that
Hmm.
situation is, but now they're affiliated and, or one's, kind of sort of in partnership with the other one, or maybe just certain areas are in partnership with each other and different practices, but
Hmm.
you may have two disparate systems and not, you don't favor one over the other, but they have to talk to each other. And maybe there's a way to automate that process such that,
It
somebody is
is.
overseeing that and they're able to maybe accommodate that in the way we used to call a PSIM, that sits on top of the systems. I'm sure
Yep.
that's possible.
Yep,
Um,
absolutely. And
yeah,
similar
go
to
ahead.
PSUM, we would call it PIAM. So PSUM is when you think like alerts and cameras and things like that. PIAM is what exactly for what you're describing, Bill, sitting between those two disparate systems, allowing both facilities, as an example, to be able to work back and forth. Yep.
The other scenario is multi-use buildings where everybody
Aha.
has different access systems. So you're an employee at whatever hospital, and maybe you just occupy some space in a medical office building that is owned by another healthcare system. So this is that same scenario as across the street, except it's across town now. So
Hmm.
again, automation would probably take care of that as well.
Another one for you. Um, so there was a facility in the southeast. Um, It goes back to an example we spoke about before. Through acquisition, they had lots of buildings. The physicians that worked for them carried around all these badges. They were trying to go to, the holy grail of one card, so it's smart card technology, et cetera, where it's one card, that could be managed across all it could be given to the physicians and care team, and no matter what the access control system is, it would be able to manage their access. Why isn't there an adoption of something to manage multiple cards when it comes to healthcare?
Well, the systems sometimes don't play nice with each other, so
Mhm.
that's probably the main reason. And I've seen that in a couple of different facilities I've either worked in or have seen as a security consultant.
Right.
So, and then you have maybe it's just the management or administration who are the barrier, or maybe you just don't have the people who have the experience and the knowledge on how to make that happen. Of course, you need strong integrators and people who can design things like that and accommodate it between the two platforms.
Yep. Yeah, that's there now. Just not sure why there's not more of an adoption in some place that needs it, like healthcare with disparate systems and doctors and care team that are carrying around, in some cases, an easy 3, 4 badges, easy. Um,
Sometimes it comes
and
down
it's an
to
issue.
the people asking, if it's a matter between a couple employees, or maybe it's the chief medical officer now who wants this convenience. So, you know, depending upon who they are in the organization, that organizational will that I was talking about earlier, that can change depending upon who's wielding the influence.